But first, in the past 15 months, we've been flooded with public health messages concerning the pandemic. We were first told not to mask and then told masking, including when outdoors, was vitally important. And now there's new advice suggesting masking outdoors may be pretty useless and perhaps even harmful. But one message has been curiously missing from the many government ads we've been subjected to. We've seen plenty of taxpayer-funded ads, from the dire Victorian government propaganda featuring celebrities lecturing the masses about the benefits of lockdowns, to the more mundane public health messages about social distancing and washing your hands. But curiously, we haven't been educated about some of the pertinent facts about this deadly virus, like the survival rate, the average age of deaths, and importantly, the risk factors posed by obesity. Of course, we've known coronavirus is particularly dangerous for those with serious pre-existing conditions, but the risk factor posed by obesity has been largely underplayed, despite being known from as early as March 2020. I was writing about this in mid-last year, but the public health campaigns never came. We now have data that shows the overwhelming majority of global coronavirus deaths occurred in nations with high levels of obesity. Indeed, a report by the World Obesity Foundation found that 88% of deaths due to COVID-19 in the first year of the pandemic were in countries where more than half the population is classified as overweight. And almost 80% of hospitalised COVID-19 patients in the US have been overweight or obese, according to a US Centre for Disease Control and Prevention study. Writing in The Australian today, Adam Crichton points out, in Japan, home to one of the oldest populations, COVID-19 deaths remain less than a 20th of the US rate. And it didn't even lock down, as most US states did. As Adam points out in his excellent piece, the CDC's latest update on the 569,000 Americans who have died from or with COVID-19 in the past 13 months, it points out that in only 5% of cases was COVID-19 the only cause. The remaining 95% of deaths had an average of 4 comorbidities. Some of these can't be helped. We've got things like cancer, dementia, chronic kidney disease. But some can be helped, particularly obesity. Surely, if we want those most vulnerable to properly protect themselves and take measures to reduce their risk, then we'd be clear in communicating the message that morbid obesity and COVID can be a deadly combination. This isn't about fat shaming, but about accurate, effective public health messaging. But instead of telling the public to get fit and get plenty of sun, we were all told to stay indoors, where people only got fatter and fatter. And this is all the more galling because we have known for over a year that there was a very clear relationship between obesity and COVID complications. In April last year, Dr. Quanta Ahmed, who was working at the COVID coalface in an intensive care ward in New York City, wrote, "Our patients seem almost universally obese, while most ill but stable patients elsewhere in the hospital have lower body masses. Critical care doctors in other parts of the country, as well as my colleagues in Europe, report seeing the same thing." We interviewed Dr. Ahmed on this network back in April 2020, and she made it abundantly clear that weight issues led to devastating COVID complications. You wrote about how many of your critically ill patients happen to be obese. Tell us about that.
That's a very important point. And in fact, that's true not just for my critically ill patients, but for most of them that we're seeing in our institution. And data was published from NYU Langone showing that people who are obese are more often admitted into the intensive care unit. This is why I'm very fearful for the progress of the coronavirus pandemic here in the United States, because we have some of the world's highest obesity. 42% of Americans meet the definition of obesity now. 70% of us are overweight. 10%, almost 35 million people are morbidly obese. So we can expect the coronavirus will have a very severe course. That is because obesity affects your built-in immune defenses, and it affects your ability to mount an immune defense to a new challenge, a new virus.
The data from England was the same as what they were seeing in the US. Public Health England found that COVID-positive patients who were obese were more likely to die or require hospital treatment, and the fatter the patient, the higher the risk. So why haven't we in the past 12 months been inundated by public health messages about the dangers of obesity during the pandemic? Instead, we've had magazine covers normalising obesity. We've had lectures about fat shaming and the racist origins of fat stigma. You'd hope that government ads, at least, would make it clear that the risk factors, including obesity, can have severe complications, and so people could make some informed decisions. Those at greater risk may choose to take additional precautions. But as Adam Crichton wrote in The Australian today, rather than promoting exercise, weight loss and cheaply available vitamin D, governments deliberately scared people, so much so that more than 40% of Democrat voters in the US think the risk of hospitalisation if infected with COVID is more than 40%, when the correct answer is between 1 to 5%, and much lower than that if you are a healthy weight without pre-existing conditions. It seems public health officials are too scared about being accused of fat shaming to give the public clear and relevant information vital to their health during a global pandemic.